Assalamu alaikum viewers, program Bone and Health. Dr. Khawaja, Sajid, Aslam is here. Today we are discussing a topic, infection in children. This is one of those problems which is neglected or not taken seriously most of the places. Even the patient, even the attendants, parents, even doctors. Majority of them, they just take it easy. They say, okay, 1-2 days we can treat by ourselves, and then. So I thought, why not to do one program to initiate the public awareness about this important and serious issue. Infection, first of all, is most common in extreme age groups. Either is very common in very young children, like 1 day old, 2 days old child, or very old people like 80, 90 years old patients. Those extreme age groups, they are the most vulnerable for infection. When I talk about the infection, I'm an orthopedic surgeon, so I'm talking about the infection in the joints. So which joints are mostly infected is the hip, then the knee, then other joints of the body. The topic we are just confining towards the children, infection in small children, or problem with the children is they cannot speak. If they are very small, like 2 days old child, he cannot speak. He cannot tell you where is the pain. He can just cry, or he cannot move the limb, but he cannot tell you where is the pain or problem. Even little bit older children, most of the time they cannot tell you. So it's the responsibility of the parents or the attendants who are around is to take care of children. Whenever you feel that there is something wrong, you have to take them to the orthopedic surgeon to get it checked. Infection is very serious thing. Why infection is very serious thing, especially the infection of the joints? Infection of the joint is entirely different than the infection on the skin or any other parts of the body. Different in the sense that every joint, either a small or a big joint, every joint has a cartilage in between, which is kind of cushion thing between two bones. That cartilage is very important to keep the pain-free joint. Whenever we move the hands for the small joints of the hand, or we walk, we move hip, we move knee, big joints, they are pain-free because of that cartilage. If that cartilage is gone because of any reason, especially if we talk about the infection or arthritis or any other trauma or anything, then the pain starts. What infection does is a bacteria very quickly and gradually start eating this cartilage. Once this cartilage is destroyed, it's irreversible. This thing you have to keep in mind. Either this is child which is growing. Some people, they believe that even the cartilage is damaged, it will regrow because the child is growing. It's not entirely true. Once cartilage is gone, it's gone. So rest of the life will be really painful. So there will be two entities. Either the patient present to the hospital, either this infection will be treated and patient will be cured, or infection will spread in the body, lead to septicemia, and patient will die. The most important thing in joint infection is to treat them early. First is to save the cartilage of the joint. Second is to prevent the septicemia, because to treat the patient in septicemia is very, very difficult. Very difficult. Even in Western world, even where the highly specialized units are there, all resources are there, even there the treatment of septicemia is entirely different, and the mortality rate is very high. So to prevent these two potential complications is very important that the attendants or patient, they shall present to the hospital very early. How the small child, I would say small child will present? I mean, how will you will seek medical advice for that? First of all, if the child is very small, that's 1 day old, 1 week old child, when the mother change the nappy and give them bath, you will see the one limb is not moving. Or when you try to hold the leg or any joint, child is crying excessively, cry more than usual. Yeah. or you can see the swelling, but the hip joint usually does not show up swelling because quite deep. Knee joint, yes, knee joint shows the swelling and redness as well, but hip joint does not show. So if knee, you can see the swelling, you can see the redness as well. Or if the child is a little bit bigger, like walking age or running age, child will limp. Yeah. So if there is no history of trauma, if child didn't fall, first thing you have to think is infection. Regardless child has a fever or not, so immediately take the child to the doctor. If one doctor says, give you medication, and within 24 hours you don't feel any benefit, get second opinion. I would suggest for this kind of problem, you shall go to orthopedic surgeon. Orthopedic surgeon is the one who has experience to pick up these kind of potential problems, because once they are delayed, as I said, because my personal professional experience is many patients with infection, in the beginning, as I said, many patients with the infection, either they are mistreated or they are ignored. Nobody could pick up them that this is a joint infection. So you should go to the specialized person, specialist doctor who have the experience about this, who can pick it up and treat it early and aggressively. So to minimize the potential problems. Take care of yourself and your family. On display there is my contact number, and if you want to discuss any other problem or you want to get the appointment, you are most welcome. Thank you.